Why am I so depressed when my body hurts? This is a question that I constantly get. And while the answer might seem obvious, it really isn't that simple. So it's vitally important to be informed to make the right decisions with your doctor. In this video, I want to show you some of the ways that chronic pain leads to depressive symptoms and explain their intimate connection. So please stick with me to get then information about your way out. Hi, I'm Gideon from PAIN.PAUSE.LIVE. I'm a psychologist and psychotherapist in Germany, and in this channel, I want to give you sound scientific information all around chronic pain and mental health. In this video, we're going to cover a short overview about what is chronic pain, what are typical depressive symptoms, when do we talk about depression, what are the factors in chronic pain that foster depression, and what can you do when you detect all these things. This video is for educational purposes only, and it's not thought as personal, medical, or therapeutical advice. Chronic pain and depressive symptoms can be very serious conditions. If you suffer from one of these or both, please turn to your doctor as soon as possible. In case of emergency, don't hesitate to turn to your next hospital or call an ambulance. Now, that was easy. But what is actually depression? When we talk about depression, it's always good to look at the diagnostic criteria. For this, I take the criteria of the International Classification of Diseases, ICD-11, by the World Health Organization. And here it's stated, a depressive episode is characterized by a period of depressed mood or diminished interest in activities occurring most of the day, nearly every day during a period lasting at least 2 weeks, accompanied by other symptoms such as difficulty concentrating, feelings of worthlessness, or excessive or inappropriate guilt, hopelessness, recurring thoughts of death and suicide, changes in appetite or sleep, psychomotor agitation or retardation, and reduced energy or fatigue. As you can see, it's a whole list of criteria that have to be met to call it a depression. For pain patients, a lot of them seem pretty normal. As we know today, the symptoms of depression can have a lot of courses. Even more so when you suffer from a pain flare-up. If you find yourself to suffer from some of the symptoms that I just mentioned, please turn to your doctor to talk about it. Today, there are good ways to help. Some of them I will talk about later in this video. To discriminate depression from just feeling down, a certain number of criteria have to be met. Concerning chronic pain, one of the most interesting seems to be here the time criterion for feeling depressed for at least 2 weeks in a row. This is so important because as pain patients, we often feel down, depressed, sad, want to withdraw as long as the pain gets worse or is really bad. But most pain patients already feel better when the pain starts to fade, isn't it? So they never meet one of the most important criteria. If this is true, technically spoken, no one is allowed to diagnose you with depression. But arguably, why shouldn't it be true if you find yourself in the same state just a couple of days later? This is a typical dilemma for doctors or therapists, which is often overlooked. While a lot of effort is put in the diagnostic manuals to fit for most people, it doesn't always work out. So what are the factors that lead to depression when you're in chronic pain? First, inflammation. For a long time, this part has not played a role in diagnosing depression when in constant or recurring pain. Nearly everybody knows that when we feel sick, we tend to withdraw. Our mood is low, we don't want to do anything, and often enough, we're not hungry at all. Sometimes we even feel a bit sad and just want to sleep. In case of a disease, this is what we call sickness behavior, and it's induced by our immune system. It's a very important function for our recovery so the body can heal. Now, as you might have guessed, the symptoms on the surface are the same as in depression. So sometimes what looks like depression on the outside is actually a sickness behavior coming from the immune response of a body that wants to heal itself. But also in general, we find a higher level of inflammatory markers in quite a lot of people suffering from depressive symptoms. So before you run to your doctor to tell him that your low mood is just all inflammation, please watch the rest of the video to get a better picture. Depressive symptoms are often very general and can have a lot of causes. Pain is associated with low mood. When we experience pain, a complex pattern of activation in our brain is involved. A study of 2017 showed that over 40 parts in your brain are activated. You can find the citation in the description of this video. The signals coming from the spinal cord go up to a region in the midbrain called thalamus. From here, the signals are distributed into different parts, and a lot of them are by themselves interconnected. One of those regions is in the limbic system where mood is controlled. It's called the anterior cingulate cortex, short ACC. Another region that is activated is the prefrontal cortex, especially the part that plays a role when we engage in critical or negative thinking. So you can say we are hardwired to feel bad when we are in pain. This is remarkable because it may save your life when there's a structural damage or an acute disease because you just want to withdraw. On the other hand, when the pain is chronic, it's a source of suffering and frustration. Another part of the limbic system that plays a crucial role is the amygdala, which is an important part when feeling stress and tensing up to anxiety and fear. This part warns us that something dangerous might go on here. So as you can see, by the mere experiencing of pain, we can show symptoms of depression. If you suffer from long-lasting and ongoing pain, these symptoms can become more and more severe and eventually end in a real depression. But wait, there's more to come. If you got something out of this video so far, do me a huge favor and just click or tap on the subscribe button below and give it a like. This way, you can help me to produce more videos and spread this information to people who really need it. Depression and learned helplessness. Learned helplessness is a concept that Martin Seligman discovered when he researched the factors that contribute to depression. It describes the belief that you have no control over your circumstances. This can lead to feelings of helplessness, withdrawal, and eventually even depression. It is something that a lot of people suffering from chronic pain know. Having tried so many things to get rid of the pain, and most of it, or maybe all, didn't work out. This leaves us helpless, and we don't know how to handle our situation anymore. Eventually, this might lead to withdrawal, hopelessness, and a loss of self-worth. Since this is such an important topic, I already made a video on it. You can find it up here. Pain, depression, and the lack of positive reinforcement. Over the course of the journey through chronic pain, lots of people lose friends, sometimes their work, hobbies, and start to withdraw from many areas of life. A lot of what makes life worth living seems to be lost. This is what we call a loss of positive reinforcement. But we need this reinforcement to live a life we can value. If this is not given, depressive symptoms tend to show up. In this case, they are like a warning signal that tells us, hey, something's wrong in your life here. Furthermore, what happens when we withdraw from our hobbies and social contacts? We get lonely, don't we? And when we are lonely and suffer, our mind usually doesn't come up with the most vibrant and exciting ideas. Mostly it revolves all around our misery, our pain, around what didn't work out and how difficult the future might be. So to get new ideas, positive reinforcement is utterly important. Actually, one of the most healing and helpful things we can do is building up new activities we can value. Something we can value in our life, maybe picking up old habits or relationships as far as possible. I know this is easier said than done. Often enough, we need someone from the outside to help us with it. How depression reinforces pain. It is not only that long-standing pain can lead to depression. It's also the other way around. Depressive symptoms can feed into the pain. How does this work? In most cases, depression looks only passive from the outside. Inside most people, there are a lot of unpleasant thoughts, emotions, and sensations going on. All this can be highly stressful, and this stress feeds into the pain, making it worse. I already made a video on stress and pain. You can see it up here. Pain shows up only during a depressive episode. Now that we talked about how chronic pain leads to depression, let's take a short look the other way around. Because it's not uncommon that you might suffer headaches or belly aches, sometimes an aching bed during a depressive episode. The mechanisms behind it aren't very well understood up to date. But two things can be taken into consideration. First, there may be some slight inflammatory processes in the body during the depressive episode. And secondly, depression is accompanied, at least in most cases, by a heightened level of stress and tension. If this goes on for a longer time, it's likely that the alarm system for pain is also triggered. Usually, this kind of pain vanishes when the depressive symptoms decrease. If it gets too much during the depression, I'm certain that your doctor can also help you with the pain. In this case, we usually don't speak about chronic pain, and it normally will be treated more like an acute pain. But as I said, for this, it's utterly important to talk to your doctor about it. What to do now? As I promised in the beginning, I will now tell you some ways that can lead you out of this dilemma. I know that I didn't touch all the causes of chronic pain and depression, but for the length of the video, I want to conclude here. First step, get a good pain treatment. Sincerely, this is essential. Since the late 80s and early 90s in the last century, we know that a combined effort of specialized doctors, psychologists, physiotherapists, and sometimes social workers can get the maximum result for you. If it's possible to lower the pain to a level you can stand while getting more active again and learning how to deal with the pain and the circumstances of your life right now, it's a good way not only to tackle the pain experience, but also the depressive symptoms. The best is when all of the therapy goes on in a setting where the therapy is coordinated. We call this an interdisciplinary multimodal treatment. I know in most countries this form of treatment is very rare, but maybe it's right around the corner. The next best thing is to have all these things separately. And if there's no possibility, get social support by a self-help group. Yes, they are the next best thing. Even if you go to therapy, self-help groups might be really, really helpful for you. In general, the first step is always to be informed. So don't stop here. In this video, you get more information on the learned helplessness I talked about before. And here I tell you more about what's happening in your brain when in pain. See you stepping into life.